going to be doing my GI nursing skills for this video. I have washed my hands and I've provided privacy for her. I'm going to go ahead and don gloves. I've already assembled my equipment. I have my chuck, my syringe, my 16 French NG tube, my tape, and my lubricant. I'm going to go ahead and assess my patient's nares, making sure they're moist and her oral cavity. Now I'm going to go ahead and place my patient in the high Fowler's position. Okay, I'm going to place my patient a chuck for her, just in case she does vomit while doing this procedure. I'm going to provide her an MSS basin as well. Okay. I'm going to go ahead and open up the packaging for my NG tube. I'm going to go ahead and measure the tube for proper length from the tip of the nose to the ear and to the sideboard process. And I'm going to go ahead and mark it with tape. Okay. Next thing I'm going to do is wrap the tip of the tube around my fingers so it can loosen up and have an easier insertion through the nares. Okay, I'm going to go ahead and loop up the tube, and then I'm going to go ahead and ask the patient to flex her head back, and then I'm going to go ahead and insert. Once I feel resistance, I'm going to have the patient flex her head forward and ask her to swallow. If it's hard for her to swallow, I'm going to go ahead and provide a cup of water for her and have her start drinking it and swallow. And once she starts, every time she swallows, I'll go ahead and insert the tube. If the patient starts to choke or gag, I'm going to ask her to state her name. If she can't do that, I'll go ahead and remove the tube and contact the physician. So I'm have her swallowing, and every time she swallows, I'll keep inserting the tube until I reach my mark. Okay. I reached the mark. And once I'm there, I'm going to go ahead and make sure it's in the proper placement. So I'm going to get my syringe, and I'm going to go ahead and insert a air bolus. And I'm going to grab my stethoscope and I'm going to go ahead and listen for gurgling sounds. Okay, I hear gurgling sounds. And also another way to check for placement is aspirating and checking the pH level. And you should, once you aspirate, you should see a cloudiness or greenish gastric juices. Once I'm done with that, I'm going to go ahead and clamp the tube. I'm going to go ahead and pin it to my patient's gown or insert it into the suction cup. And I'm going to also place a tape on my patient's nose for so it will stay in place. And once I'm done with that, I'm gonna put my patient back on a I'm gonna put the head of the bed to a 30-degree angle and go ahead and wash my hands, and then document the placement of the nares, the size of the tube, and any nose secretions. Okay, now I'm gonna go ahead and do the NG tube removal. I already have all my equipment in place. I've changed my gloves. And now I'm going to say to the patient, I'm going to remove I'm going to remove the NG tube. But first thing I have to do is check the MARS and check the bowel sounds for the patient. We need to check if there's bowel sounds. If not, leave the tube in place and contact the physician. Okay, so I hear normal bowel sounds are four quadrants. So I'm gonna have the chuck in place, and I'm gonna have the patient ask her to breathe and take a deep breath and hold it. And at that time, I'm gonna go ahead and remove it. I'm gonna go ahead and remove the tape. And at this time too, I'll have tissue for her, so when I remove the tube, she can go ahead and clean her nose. So I'm gonna have the patient take a deep breath and hold it, and while she's holding it, remove it. Okay, put it in the chuck and wrap it around. Ask the patient if she okay, if she felt any pain, and go ahead and if she hasn't, go ahead and put her back on a 30-degree angle on her bed. Lower down the bed and raise the rails, and have her call out and reach, and then document the patient's reaction again and if there was any nose secretions. Thank you.